Broadband Breakfast Live Online for Wednesday, December 21st, 2022. Happy holidays, everyone. We're rounding up towards the last couple of episodes for the year and very excited to have another program that we think gets at some of the important issues of, kind of people together, holidays, making sure we take care of those who need assistance and help, and of course talking about broadband and better broadband, better lives. That's our motto here at Broadband Breakfast. We do reporting every day, every business day on broadband technology and internet policy, and we also do these events every Wednesday. And wanted just to kind of give a shout out to some of the events that are coming up in coming weeks, right? So in addition to what we have today with a focus on telemedicine, robotics, and future health, we will be speaking next Wednesday, the 28th, will be a recap of the year behind 2022 and the year ahead in 2023. And we do have several guests that will be speaking on that program, including Sean Buckley, the editor-in-chief of Broadband Communities, Linda Hardesty, the editor-in-chief of Fierce Telecom, and Sean Gonsalves, the senior writer and editor at the Community Broadband Networks Initiative. So those are some of the guests we're going to have next Wednesday. The week after, we will be live from Las Vegas for the Consumer Electronics Show, or CES, as people refer to it these days. That program, we will kind of be laying out more about that in the coming weeks, but we will be live from CES. So we hope you'll join us at the same time, Wednesday at 12 noon Eastern time. And I also wanted to remind you, as I mentioned in the past couple of episodes, about the launch of our recent Broadband Breakfast Club. I'm going to go ahead and share a screen here for a moment so that you can see just a little bit about our Broadband Breakfast Club. Here is the screen, of course, for our Broadband Breakfast Live online events. And of course, our website changes every day because we're constantly publishing news stories. This is our homepage. These are the core areas we cover: broadband infrastructure, broadband's impact, and big tech. But I wanted to call your attention to the Broadband Breakfast Club, and you can sign up for the Broadband Breakfast Club. We've actually just recently produced our December report. These are the key benefits of joining the Breakfast Club: exclusive access to our signature course on digital infrastructure, 2 hours of monthly group coaching on broadband deployment, exclusive monthly report on the latest broadband developments. And for December, we've been focusing on the 12 days of broadband. And so these are the 12 days of broadband, kind of just a whimsical way, perhaps, to get at the key issues. But these are substantive topics, and we've done a report on them. The first day of broadband, my true love sent to me a symmetrical gigabit network. The second day, 24 reverse preemption pole attachment states. The third day, Section 230 of the Communications Decency Act. The fourth day, $42.5 billion in broadband equity access and deployment funds. Each of these 12 topics are covered in our recent report. And I'm going to go ahead and share that screen with you so you can just get a taste of this. This is the report that we've produced. Is available to all Broadband Breakfast Club members. You can sign up now through January 4th for the discounted price of $60 a month and lock in your membership rate going forward to 2023 and beyond. It will be going back to $99 on January 5th. But this is the first article, the first day of broadband, symmetrical fiber networks. The second day, 24 reverse preemption pole attachment states, Section 230 of the Communications Decency Act, the BEAD funding, the five FCC commissioners, right? That's the fifth day. We talked about the rise of Wi-Fi 6E and other spectrum developments. Day 7, discussing inflation the high inflation and acute workforce shortages issues, and how much of a toll that's put on broadband industry. The eighth day is talking about the 8,132,968 census blocks and the broadband fabric, which is going to be really very much, even as we're all kind of going off for the holidays. I mean, people are focused on the January 13th deadline to challenge the FCC's initial broadband map and fabric. The Universal Service Fund, right? The $9 billion in Universal Service Fund, that's the 9th day of broadband. The 10th day is the $10 billion remaining in the Affordable Connectivity Program. The 11th day is about banning TikTok and growing security concerns keyed to the 11th year of Xi Jinping's rule in China. And the 12th day is 12 state broadband offices. So we hope you will join the Broadband Breakfast Club. All the information is on Broadband Breakfast so that you can find out more about it. And through January 4th, join us for the special discounted price of $60 as we lead up to the conclusion of these 12 days of broadband. Well, thank you for being with us. We do have a great audience that's joined with us. I'm going to introduce the guest that we have live right now, and I'm sorry to report that that Craig Settles, who was really instrumental in putting this event together, has got laryngitis and won't be able to be with us. But we are very excited to have Dr. Arshia Khan with us, and we're going to talk about the topics we're focused on here, really, which has to do with robotics, telehealth, and future health. Right? And smart technologies, robotics, remote monitoring, wearable devices, these all hold incredible promise for the future of healthcare, particularly those living in remote rural areas and urban residents unable to afford traditional care. But will the broadband in those communities keep up with the needs, right? And so we're gonna talk about that today, and it's also a great lead into CES, right? There's all kinds of robots and robotics there. But while we get ready for this, I do also don't want to neglect to thank our sponsors. So let me go ahead and give a shout out to all of the sponsors of Broadband Breakfast, which make it possible for us to do this free programming every Wednesday. Those sponsors include Utopia Fiber, Broadband.money, Google Fiber, Broadband Now, Lightbox, the Wireless Infrastructure Association, Geo Partners, LLC, Ookla, Pinpoint Capital Advisors, Michael Baker International, Bitstream Communications, Positron Access, and the California Emerging Technology Fund, as well as broadbandtoolkit.com. So again, we thank our sponsors, and now let's turn to our guest, Dr. Khan. One more word about our guest so that you all have a little bit of information about her. She has been in this field and has really been working to direct the growing, emerging new field of biomedical and health informatics, especially in the areas of neuroscience and therapeutic robotic assistive technology, together with sensors and Internet of Things. So this research offers a lot of promise, and she has a special guest with her, a robot. And so let's hear a little bit from you, Dr. Khan. Thank you so much for being with us on this program. Tell us a little bit about your work in this field and some of the challenges that you see in robotics, telemedicine, and future health.
Thank you, Drew, for inviting me. I'm really excited to be on this show and talk about my research. So essentially what I'm trying to do is trying to bring robotics into elderly and dementia care. So during the pandemic, most of us have realized that, human beings can spread infection very easily. So why not have the robots help us assist in caregiving? So there are so many mundane activities that, are repetitive. And as caregivers perform those activities, there is a little bit of, irritation, and repetitiveness sort of causes, change in the tone and change in the attitudes towards the person they're caring for. But the robots, their attitude, their tone would never change. So, for example, if supposing somebody needs to wear an oxygen mask, and that person has dementia, there has to be somebody there, reminding them constantly, saying, hey, you need to put on your oxygen mask. And after maybe like 10, 15 times, there might be a little bit change in tone. But if the robot does the same thing, constantly reminding, saying, hey, John, your mask is off, put it on, please. The robot's tone would never change. It would still remain the same. So that is a simple repetitive task. But beyond that, elderly are feeling very lonely, isolated. The robot can offer companionship. Robot can offer the social interaction that they're missing in their lives. Robot can chat with them, talk to them, entertain them, connect them to their family members, via a tablet on their chest, and tell jokes, do karaoke with them, play bingo with them, play all sorts of games. There is so much that robotics can do. Now, combine robotics with sensing technology, and it's a win-win situation. So currently, the way healthcare works is we wait for something to happen, and then we go and see the doctor, right? We wait for some event to occur, and then we try to react to it. So it's more of reactive care. Whereas what I'm proposing is more of a proactive care. So using sensors, using spatial and wearable sensors that we can wear on our wrist, on our body, in terms of clothing, in terms of watches, and then we can actually track the physiological data and be able to predict something that is going to happen. So turning towards more proactive medicine is what I'm proposing, using robotics and wearable sensors. There is so much that we can explore. I'm only working in a small area with elderly and dementia care. There is so much that can be done with children, with anybody with mental issues, with depression, with anxiety, children on the spectrum. There is so much yet to be explored with robotics in healthcare. Of course, we have been using robotics in surgery and for precision surgery and stuff like that. But I think we need to think beyond that. And that's what I'm proposing. And that's what I have been doing. So I have 16 robots deployed across 8 different nursing homes in Minnesota. And we are performing activities in 3 different domains. One is the physical well-being, where our robots do yoga. They perform different kinds of exercises, such as strength training, upper body, lower body. So this little guy here does very good exercises, and he can lead elderly in exercises, and they actually enjoy watching him. He's so cute, and he's got an attitude as well. And then the second domain that I work in is cognition. In cognition, we are doing, we are trying to help improve their cognition. We have various kind of applications in that area. And then the last domain is emotional well-being. For emotional well-being, our robots tell jokes, they do stand-up comedy, they do karaoke, they play bingo. There's a lot of things that our robots do.
Well, I guess I lied when I said we just had one guest today. We do have another guest, the robot. What is this robot's name right here next to you?
Yeah, he is Perry Perry.
Perry Perry. Well,
Yes.
let's hear from Perry Perry. Tell us a little bit about yourself, Perry Perry.
Peri Peri will do things. He's not very, the bigger robot is more interactive. This one does things. So would you like him to do yoga maybe for him, for us?
Of course, please.
Look at me here. Yoga? There. Yoga?
Let's go. Hello everyone. Let's begin our yoga session today. We are going to be in a comfortable seated position. You can all sit on your mat and cross your legs. Do what is comfortable for you.
He can do dances also. He's very good at dancing.
Uh-huh. So
So we'll stop him at this point.
So you were talking just a little bit earlier, Dr. Khan, about the physical well-being, the
Emotional well-being.
the emotional well-being, and the cognitive. So give us a little more about the use case for I'm sorry, his name again, or
Peri Peri.
Peri Peri, the use case for Peri Peri. Is Peri Peri equipped in physical, cognitive, and emotional, or do you have different
robots for different things? Yes. So this little guy will do dances. He can do entertainment, but he cannot do the cognition, and then the for social well-being, all he does is dances.
Mm-hmm. So can you do a dance for us? How does the dance work?
Yeah. He's going to dance now. It's a little slow getting started.
How did you tell him that he was gonna dance?
I have a program that we just run.
Okay.
So a couple of different ways we can run him. One is by voice command, but there's voice command. We don't rely on that in nursing homes because the nursing homes are very noisy.
Do you know Macarena dance? Here you can see how I am doing it.
All right, so I can run him via voice command or by choreography, the software that we run. Yes.
So let's talk a little bit more about the differences, right? So we're talking about, and thank you for the comment there, Chelsea, about the robot's adorable. So the robot's good at the physical work, the yoga, the dancing, isn't so good at the cognitive work, right?
This one cannot do cognitive. We haven't programmed him to do cognition.
Okay. Let's talk about well-being though, and emotional well-being. How does a robot help emotionally?
So a robot can entertain the person, just sit and interact and talk to the person, can tell jokes, can play bingo with them, can do karaoke. And that is really good for their social well-being. We have done studies where we have found that that has really helped improve their emotional well-being, the before and after. We have actually used wearable sensors, and we have seen tremendous changes, in the person's attitude towards life, just for that reason, because they love the robots and they're able to interact with the robots.
How long have robots been used in the health context, Dr.
So
Khan?
in the health context, robots have been used for many, many years now. They have been used in surgery mostly, but this is where I have been bringing robots into nursing homes and elderly care as humanoid robots. So humanoid robots, this is the first time in the history of US. Of course, they're being used in Japan, but not in the US.
Yeah, more advanced there. So who makes Peri, and is there any kind of like certification or interaction with the medical profession in its work here?
So there's a company called SoftBank Robotics that's out of Japan that makes them. And then there is a local distributor within the US that sells them. They are Robolab. And so I buy the robots from them and we program the robots.
So like how does it work? I mean, like who is the purchaser? Is it the health company? Is it the nursing home? I mean, what's the kind of the way it fits in the business cycle here?
So the nursing home purchases the robot, because if the university purchases, then it will belong to the university, and after the time period, whatever the contract is for them, the robots would come back to the university. But the way we have been working with the nursing homes is the nursing homes purchase the robots, and then we deploy our applications on the robots. So I provide the software support for all of the robots, yeah.
Okay, so we didn't perhaps give as much attention to your role at Professor and Director of Graduate Studies at the University of Minnesota, Duluth. Tell us a little bit more about what you teach and what the work of the graduate students is in this domain, the robotics domain.
So I teach in the computer science department, mostly computing courses. One of the courses that I teach that is related to this is sensors and IoT, Internet of Things. And that's where I teach robotics. I have a really good, well-equipped lab where there's about 20 different types of robots and 30 different types of sensors and different things that the students work on. That course that I teach is a very hands-on course. There's very few lectures in there. Mostly the students are building Internet of Things. They're building applications. So instead of just reading about technology, they're actually building technology in that lab. Mm-hmm. So, and as the Director of Graduate Studies, my role is to manage all the graduate students to make sure they learn about research. And then, some of those graduate students are my advisees because the other faculty also advise graduate students. So my advisees, when they are working in my lab, they get to work with the robots as well. They get to program the robots and be involved in this. And eventually we will be turning this into a business, and hopefully the students will stay on because the graduate students, they graduate,
Will the business be the university, or will it be a separate entity, or is there already a separate entity running?
It will be a separate entity, yes.
Okay. We've got a question from Doreen Cornwall. We want to encourage your questions for our guest today, Dr. Arshia Khan. Doreen's question is, do seniors have trouble understanding the robot's voice? Can he give verbal instructions for seniors with vision loss?
He can definitely give verbal instructions. We are using the robot for that. And that's an excellent question. Not all the elderly residents are able to understand the robot very clearly. Excellent question. So what we are trying to do is tap into their hearing aids.
Interesting. Doreen has come on screen. Do you want to follow up with your question there, Doreen?
No, I think that was enough. I just wanted to appreciate the answer. Actually, I do have one more question, which is, I assume, can the robot's voice also be changed? Because sometimes adjusting hearing aids would be the solution, but sometimes for different reasons, adjusting the voice might be an option. So I'm just curious about what the options would be for that.
Yes, we can definitely change the pitch. We can change the language. We can change, there's so much we can play with the robot, and higher pitch, lower pitch, and we are experimenting with all of those things, Doreen.
Thank you. Thank you for being with us. So I want to, again, encourage your questions for all in our audience here with Dr. Khan. I want to get, though, to the issue of broadband and its usage. Okay. And I know that's something that Craig definitely wanted us to cover. And again, so sorry that his health has not permitted him to be here today. But could you talk a little bit about the kind of bandwidth needs associated, right? I mean, and maybe there's not a lot of bandwidth needs, which is okay. Just in these cases, tell us a little bit about what kinds of bandwidth we're talking about.
So we do have high bandwidth needs because all the data, because of HIPAA, we are trying to follow the HIPAA, and we do not save anything on the robots. So everything is saved on a secure server. So all of that is streamed live to the server. So we do have high bandwidth needs. And so the nursing homes have had to change their, providers and upgrade so that they could meet our robot needs, because it's not just the robots, it's also the wearable sensors. All of that data is continuously live streaming, and it does, take up quite some bandwidth. I see some more questions there.
Right. Chelsea Bagwell asked a question. Accessibility is important, and I am glad you are considering that. Chelsea also noted earlier the robot is adorable. Talk a little bit about, I guess, the sort of the human robot interaction, right? And because clearly there's lots of, there are robots that don't have a form factor, right? So yes. Like what led you to kind of decide, hey, let's make this a kind of a human-like robot?
So when I was first working with robotics, I was working in the area of, recovery after open heart surgery, because my dad passed away, because of congestive heart failure. And I was seeing my mom struggle, care for him. So at that time, I was thinking, how can I help, And of course, my first reaction was I would like to build an artificial heart for him. That was really not possible. So then I started exploring how can I help. And then I also realized that a lot of nurses injure their backs and knees helping people out of bed. So that was my first project. I was working with Dr. Boylan, who's a cardiothoracic surgeon at St. Luke's here. And we were trying to build this robot to help people out of bed. That is a 6 foot tall, 600-pound robot. And it's pretty intimidating, So then when I got into dementia care, because most people who have any sort of heart disease are at high risk for dementia. So then I got into dementia. And when I started working in this area, that's when I realized that big robot can be pretty intimidating. So then, these cute robots are, of course, very adorable. And mind you, when I first started working with elders, my fear was that, they're so not used to and exposed to technology as much as we are, the newer generation. So, and especially our kids, they are born with a phone in their hand, right? All these electronic devices. But the generation that I'm working with, they haven't been exposed much to technology. So my fear was they would reject technology. But these robots are so cute. The elderly in the nursing homes are so lonely. When I take these robots there, they cannot stop talking to the robots.
Mm-hmm.
So they're very, very accepting of robots.
So what kind of interactions can the robot do? You were talking earlier before you introduced us to Perry about, put on your mask, right? I mean, what other interactions are capable of
the robots can sing birthday songs. Our robots sing birthday songs, entertain them, wish them on their birthday. And then the new program that's coming out is like, it tells what's going on in that day, informs the residents, oh, today is such and such a day, and you will be doing this at this time, you will be doing yoga at this time, and breakfast menu is this thing, and so on. So it's pretty interactive as well. Some of the new applications that are coming out, I don't want to talk about because we are going to be deploying them in a couple of months. I need to get the IP taken
They're
care
under
of.
NDA until then, right?
Yes. So.
Well, and of course, the younger generation, the generation of kids, my kids and others, they're so used to it, they'll talk to screens as if they are robots, because they have those capabilities. Hey Siri, hey Google, right? And so like it is interesting how we're going to interact with non-sentient beings and devices, and obviously you've caught into something quite interesting of bringing the robotics to the healthcare field and the work that's being done there. What else would you want to say about kind of the way sensing and sensors contribute to this process, right? I mean, like just broadening out a little bit beyond robotics, like what are some of the issues in Internet of Things and telehealth and telemedicine?
So I think we currently, we all go for our annual physicals, right? So I think those physicals need to change the form that they have currently. Right now, we just go and get some lab work done, we talk to the doctor, and we are out of there, right? I think we need to think beyond that. We need to start incorporating wearable technology into that, so that the doctor, when you go to see the doctor the next time, the doctor has all this information about you, your physiological information, so the doctor is more aware of your health. When we go for our physical, we don't consider, certain things, like, for instance, dementia. Of course, when I say dementia, it's an umbrella term. It includes Alzheimer's, Parkinson's, all the various types, right? So when somebody, starts to show symptoms of any form of dementia, the disease has actually set in 20 years before that.
Wow.
So it's like 20 years later is when we are realizing that, the person is suffering from that disease. But if we can figure it out earlier than that, then hopefully we can start treating the person sooner,
Can we figure it out earlier? What are ways?
Yes, there are several biomarkers. Recently we found a biomarker in my lab for memory recall. There are a lot of biomarkers. For instance, the gait changes when a person, is affected with dementia. So if we have a baseline,
the gait,
the way we walk.
The gait, okay.
Gait, yes. So supposing, we take a baseline of our gait and track it every year, so that we can track, what is happening to our gait. There are so many things that can be done using technology. I think we need to start thinking about medicine from a different perspective.
Yeah.
Using technology. Medicine and technology cannot work side by side. They have to be intertwined.
Interesting. Yeah, no, I think we're going to see a lot more of that in 2023 and beyond. We've got a question here from Dan Smith. What's the role of broadband in preventative medicine, public health, and healthcare cost reduction? Okay, that's a great topic we could drill in a lot on, but tell us your thoughts on that, Dr. Khan.
So like I said, if we are live streaming all of this data from our wearables, of course, broadband comes into play,
Yes.
So it is critical. Broadband is critical for preventive medicine, I would say, public health and reduction in healthcare costs. So if we are able to predict something and prevent it from happening, then, we are, of course, reducing the costs. So for example, bipolar disorder, we can actually predict a manic or a depressive episode. So if we can treat the person before the episode occurs, then, we are preventing it from happening. We are reducing the number of times that person would go into the hospital.
We just finished a conference a little over a month ago, our digital infrastructure investment event. I'll put the link to it in the chat room. And the reason I mention this is in one of these sessions, in fact, we did a piece on this that I'll share that's publicly available on the website about communities. And one of the participants in that session, Dr. Wack of Westminster, Maryland, he actually kind of referred to the fact that broadband is providing such advantages in healthcare that the cost savings are really just, they're dealing with different orders of magnitude entirely, right? So if there are ways to link cost savings in the healthcare field to broadband, well, that's kind of a game changer in terms of the reasons why it's a benefit. And so, any reaction to that, Dr. Khan, about the way advanced networks, fiber optic networks can really help to drive more telemedicine focused applications?
Absolutely. I think broadband is like the foundation for technology. Without the broadband, we cannot communicate essentially, right? So if we want telemedicine, and telemedicine is getting very popular, especially in the rural areas, we need it. We cannot expect the person, like right now we have a blizzard going on. The temperature is -18 outside with a wind chill of -27. So in this kind of condition, if someone has a doctor's appointment and they're unable to make it, the best way is, telemedicine. And this way the doctor is safe and the patient is also safe in their homes, and they can still communicate and be taken care of. Mm-hmm. There are so many ways that communication can happen because of broadband. All the data that we need to transfer to live stream, without the broadband, all that data won't transfer. So as the growth in healthcare with all the wearable sensors and the different technologies, the need for broadband is only going to grow exponentially.
How have you seen telemedicine used, for example, in your work in at the University of Minnesota? Like what are do you have any sense kind of quantitatively how much it's being used now more than 3 years ago, 5 years ago, 10 years ago?
So most of my collaborators are physicians, are in the healthcare field, and a lot of them have told me, there are several psychiatrists, for instance, they haven't been in the clinic for a long time now.
Yeah.
This is all their work is happening via telemedicine. They meet the patients via telemedicine, and the patients love it. So they are able to spend more time. They are saving time in that commute. And, the time that they have to be taken to the room and back, and where the physician is going back and forth between the rooms, all they're doing is going from one Zoom to another Zoom. And telemedicine has become really, really helpful and is saving a lot of people these days.
We have a question from John Graham who asks, how common is poor broadband reliability, performance, and its impact on robot behavior?
For broadband, our robots essentially don't work. They don't do much. And so like even in my lab, we had to do a lot of stuff to get better bandwidth. And it is critical, I would say, broadband is critical for our robots to work, for our wearable sensors to work, any of our technology to work.
What happens? I mean, like what's the minimum requirements, either down or up, to operate these kinds?
It depends on the application. It depends from application to application. It depends on what we are doing. If we are streaming, just a little bit of data, it's not much. It depends on what we are doing, essentially. So
Right. Well, it's been great to spend this time with you this morning. As I said at the top, regret we didn't have some others to join us, but I want to give you an opportunity to maybe share some closing thoughts that you have about our topic today of robots and telemedicine and the broadband capacity, which you've just addressed is so important. Where do you see telehealth and robotics going in the next 3 to 5 years, and what are you kind of most excited about as you kind of look at Perry and his upgraded version?
I'm looking forward to seeing better robots in future. There is a limited inventory of robots currently, so I'm looking forward to that. I'm looking forward to a greater integration of robotics and wearable technology into healthcare. I have a lot of new applications coming out soon, so I'm super excited about that. We have a team of neurologists working with us now. There's a lot of new things that I cannot talk about, unless you sign an NDA.
We'll have to have you back. Are you going, or others in your world, going to the CES, the Consumer Electronics Show, in 2 weeks?
No, but I did receive an invitation from them. There is only so much I can do,
Yeah.
So, and there's only one of me. So, but I would have loved to go for that. But you're going to see more and more of this. I was talking to the robot company today, and they were saying more and more people are purchasing the robots as well. And we have, I'm telling all the nursing homes, if you need me to write a grant to get robots into your nursing homes, contact me.
Well, again, it's been a pleasure to have you with us. For our audience, don't miss our next week's show on a New Year's recap on the biggest stories in broadband from journalists in the broadband space. And the following week, we will be doing Broadband Breakfast live from Las Vegas and CES 2023. On behalf of our guest today, and I'm so grateful that you joined us, Dr. Khan, as well as Perry. I'm Drew Clark with Broadband Breakfast, and we'll see you next Wednesday. Take care, everybody.